Hello everyone, we are very happy to introduce our latest research results, entitled Linking Preclinical Models with Clinical Reality, VEGF-VEGFR Inhibitors and Thrombotic Microangiopathy in Cancer Treatment. Thrombotic microangiopathy, TMA, is a group of diseases marked by microvascular thrombosis, hemolysis, and platelet consumption, primarily affecting the kidneys and causing complications like renal failure and nerve damage. Anti-angiogenic drugs such as Bevacizumab and Sunitinib extend cancer survival but may induce TMA, leading to kidney issues like proteinuria, hypertension, and even life-threatening conditions. The risk differences between VEGF and VEGFR inhibitors remain unclear, and clinical factors from drug use to TMA onset haven't been systematically evaluated. There is also a lack of research on the risks of similar drugs. The main highlights of this article are the first integration of the two major drug vigilance systems, FAERS and Vigibase, to systematically confirm the risk association between VEGF and VEGFR inhibitors and TMA. Animal experiments revealed that VEGFR inhibitors induce acute endothelial injury through complement activation, while VEGF inhibitors cause delayed TMA due to signal pathway blockage. Data from local hospital patients showed a sharp decrease in platelets and a significant increase in hemolytic markers after treatment. Pan-cancer studies have identified platelet aggregation and complement activation as the core mechanisms of TMA. Our research process first extracted Vigibase and FAERS malignant tumor patient data, systematically analyzed the signal risks of different VEGF and VEGFR inhibitors, and explored the differences in clinical factors and onset time. Secondly, combined with local hospital patient data, we analyzed the changes in key biochemical indicators before and after treatment and evaluated the risk of occurrence. The animal model was analyzed through renal tissue staining and high-throughput sequencing, and TCGA combined with ROR pan-cancer analysis to clarify the mechanism of occurrence. The following are the core findings of our research. Clinical database analysis confirmed that the overall risk of VEGF inhibitors is higher than that of VEGFR inhibitors. Bevacizumab, Sunitinib, Ramucirumab and Aflibercept all showed positive risk signals, among which Bevacizumab had the highest risk. Although VEGF inhibitors are more risky, VEGFR inhibitors develop more quickly, with a median onset of only 1 month, while the median onset of VEGF inhibitors is as long as 6 months. Analysis of patients in local hospitals found that the overall platelet count dropped sharply by 28.7% after treatment, and indirect bilirubin increased by 10%, indicating worsening hemolysis. The number of high-risk patients increased from 24 to 56, a surge of 233%, and the low and medium-risk groups expanded by 14.7%. More noteworthy is that the number of patients at risk of TTP increased by 320% from 20 to 64. We used TCGA combined with ROR to analyze 13 types of cancer: glioblastoma, thyroid cancer, squamous cell lung carcinoma, lung adenocarcinoma, and breast cancer showed high risk. Correlation analysis found that VEGF signaling, complement activation, and platelet aggregation are the core mechanisms for inducing TMA. Through the kidney pathological sections of the animal model, we clearly observed that the Bevacizumab group showed widening of the subendothelial space, endothelial cell shedding accompanied by a small amount of fibrin thrombus formation, while the damage to each part of the Sunitinib group was more severe, confirming the clinical database's discovery that VEGFR inhibitors had an earlier TMA time. We analyzed the transcriptional data of the animal model. Bevacizumab significantly inhibited the VEGF signaling pathway, while Sunitinib duly activated platelet intracellular calcium signals, and the complement cascade burst activation pathway showed a stronger destructive effect, explaining its faster and more severe TMA performance. Our study is the first to analyze the relationship between VEGF and VEGFR inhibitors and TMA occurrence. It highlights the increased TMA risk with these inhibitors, detailing the timeline and mechanisms. Clinically, differentiated monitoring plans are recommended: early detection for VEGFR inhibitors and mid to late detection for VEGF inhibitors. If abnormalities or TMA symptoms occur, drug treatment should be suspended, with potential improvement after discontinuation. If symptoms persist, a complement inhibitor like Eculizumab may be recommended.